Fantastic, good. So we are now on the second session on the lower limb. Now, remember we've had the question what to do with a client that they have, we want to work on their foot and the feet, and the client were quite busy during the day wearing very insulated footwear, and we need to work on these, okay? So instead of, and this is really, you will, part of the massage is understanding the, part of being a massage therapist and understand the power of words, the power of talking in a positive way, the power of explaining something that really would be the easiest for the client to understand, rather than just explaining and stumble over words and make yourself misunderstood and the client thinking, oh, what he wants from me, yes? Especially when the client is quite sleepy or wants to relax, yeah? So, what you can do before you're starting, if you're thinking of working on the client, foot, and that's based on the consultation. Let's say the client wants you to work on the foot, or you think that it would be beneficial, and you work on the limb or lower limb, then you know more likely you're going to work on the foot. So what you can do before the massage start, to have a wet wipes. Yeah? And you can have a wet wipes. This is part of your massage kit. And what you're going to do is either before you put in the client, or if the client is lying there, you need to let them know that you are going to wipe their feet with a wet wipe. Yeah? So to do it, you could say, is it all right? I'm going to refresh your feet with a wet wipe. Yeah, is it okay? Good. So I didn't get into, I didn't put anything like smell or dirt or something. I just said refresh. Stink. Yes? So that is a lot better than just getting into, and they feel it. And they feel that is kind of refreshed, you know? It's now nice, they can, you know, it's like you're going to a Japanese restaurant, and after you eat, they give you something hot to refresh. Yeah. Yes, so nice, you can just wipe it nicely, and yeah. And you do it now as opposed to in the middle of the massage, because it will wake them up. So now, problem finished, you can now start really the massage, okay? Good. So wet wipes, part of your really kit. Let's take some, oh, thank you. Wow, if you give me, I'll take this one. Okay, so few things that are slightly, that we work a little bit different, okay? First of all, working on the leg as a whole, I will teach you the first nice mobilization technique. It's mobilization, but it's also kind of a technique that I use a lot for the lower limb. And what it does, it really oscillates the whole limb. Yeah, you can do that here. Yeah, and look what happened to this muscle as well. Yeah, it wobbles. Let's put it this way. Yeah, wobbles. You can help it with your hand a little bit. You can do it with two hands this way.
Would you recommend that method for older people?
Why not?
Okay.
If there is some problem, more specific, then we will talk. But for now, let's just talk about the technique, okay? Right. You can come and stretch this muscle. Yeah? So what I'm doing actually, I put my forearm here and nicely stretch. This way. Quite nice. And you can do the stretch with a little bit of a squeeze. So now I stretch, and now I squeeze and release. And now I stretch, and the squeeze coming from this hand. Good. You can do pretty much almost the same thing, but now with the hand, relax your leg, yeah? With your with their leg over your shoulder. Sometimes I will use a small towel. I have quite a lot of tea towels, and we'll just put this in here, put their leg, and then you can be doing a lot easier technique around here. Yeah, you can do it in this way, and you can just massaging, yeah, and squeezing it here. Really nice technique with a squeeze. Good. Another alternatives is to come and bring your leg. So how I do it, again, a nice tea towel would be nice, or you put your leg underneath the pillow, but I will do it without. So putting your leg there, and what's important, that there is a bit of a clearance here, so it's quite comfortable for them. If I will do it this way, it would not be comfortable because I'm going to stretch their ankle joint. Yeah, do you see the difference? Yeah. So, yeah, and here now I can use some oil. Even my legs are kind of grounded, I still use movement with my upper body. Yeah? Good. You can do it one at a time. You can work nicely on two sides of the which muscle group here? Hamstring.
Doesn't hurt your back.
No, but it's a good question. You have to check and see. If it does, always use an alternative. So come back to the usual technique. The reason it doesn't probably hurt my back, that I don't use my back. What I use is the hip joint. Do you see that actually hinge from here? Yeah? Yeah? So if you look at from the side, the back is not hunched. So, good. You can work around the knees more. Yeah, you can bring this and work more around here, this way. Yeah, but just the wobble, really, really nice. Even do that. Yeah. Every massage technique, you want to teach them something as well. And this one, you want to teach them the ability to relax. Yeah? You can do it also in here. It's okay, you can go out. Yeah? Okay, so, okay, that's enough. Yeah? Okay, then one more technique for the glute is when you have the towel, you can tuck this underneath and take it to the side this way. Yeah, good, just like that. Now, when it comes to the glute, I need a little bit more explanation, although we'll do more explanation once we know about the muscles and bones and joints, this area. Yeah. So remember the sacrum in the middle, and the femur. So these are the two bones around, and the muscle actually runs, or the muscles, because there are few, they runs kind of this direction. Yeah? So it's nice to work opposite direction to them. Yeah? Another group of muscle from here comes upward. Yeah? So you can come, yes, come into this direction. So you can start working on the muscles on the opposite direction. Now, it will be quite hard to find, but when you find tender point or a knot, you can really find it. And it feels like either a band or a spot that there is more resistance. It's tighter. Yeah? So, for example, this area here, I can feel more resistance. So I would work more on the side. Is it deep enough? Yeah? Okay. So when I work deeper, I need to communicate, right? So I'll ask, is it deep enough? Or can I go deeper? I wouldn't ask a question like, how is it? Because it's too open, yeah? Good. So you can work a little bit more in front. So what I want you, feel the bone here. Can you bring maybe the skeleton? Thank you. So when it comes to the side, I want you to feel this bone, this area. And then from this area, you work this distance, across it, along it, but also here, from this above it. So let's take that. This is that bone, and I work along it. Sometimes you can do it from here. Yeah, so again, you see the difference between working with my spine, and working with my hip. The spine is straight. Yeah, from the side, the spine is quite straight. Okay. And then working on the side. So, yeah, good. At the end, you can nicely do some of these pounding. And finish with a nice percussion. Percussion, hacking, cupping, pounding. You know. All right. So just as a reminder, mobilization, jostling, moving, working on these, putting around the shoulder, putting around the hip here, remember? I'll come and remind you, okay? Great. Close that.